Hey guys, it's Dave. Today we're going to discuss premenstrual dysphoric disorder, or PMDD. It is different than regular PMS, or premenstrual syndrome. It's an intense premenstrual syndrome with significant mood changes and disturbances accompanied by other physical problems as well. It occurs at the second half of your cycle and will normally go away as soon as the cycle starts, but then can reoccur again the following month as the second half starts again. Unfortunately, there's no cure for it. What generally occurs on the physical side, you can see bloating, weight gain, fatigue, tenderness in the breast, joint pain, as well as vision changes. As far as on the mental health side of it, it is a lot of the same symptoms as major depression. You'll have insomnia, feelings of hopelessness, suicidal thoughts, anger, anxiety, irritability, and a loss of interest in the things that you normally would enjoy doing. The difference between a major depressive episode and PMDD is actually in the timing of those symptoms, along with the accompanying physical things that I discussed, like weight gain, bloating, fluid retention, things like that. If you're having those kind of symptoms that I described, the lack of interest, the depression, the irritability, those kind of things throughout your whole cycle, throughout the whole month, then you probably are having major depressive disorder. But if it's just occurring in the second half of the cycle, I'd be looking at PMDD. If you keep a diary of those symptoms and share it with your provider, that would help with the diagnosis. As far as things that you can do to help yourself with this, number one, stop smoking if you smoke. Smokers tend to experience this more than any other women, so stop smoking. Second thing you can do is get in some exercise. Exercise helps boost your mood. It also helps boost those serotonin levels, because that is what they're finding. The cause is actually unknown, but what they're finding is the hormonal changes that occur between ovulation and the start of your cycle actually lowered the serotonin levels in your system. So if we can get those elevated, it may help you, and exercise will do that. Decrease your sugar intake as well as salt and caffeine. That's a little tough to do, but if you can at least lower those a little bit, it may help you out. As well as take some magnesium and B6, and I always recommend B6 to all of my ladies that are on any hormone replacement, which includes birth controls. So remember B6, 100 milligrams once a day, all the time, every day, including in the first part of your cycle, should help out with that. The other thing is, in your diet, increase your carbohydrates and your protein. That will help to maintain your diet at a healthy level, will help you as you go through the PMDD. If you can also take on some kind of meditation, that can help to relieve some of the stress, because the more stress you have, the more apt you are to suffer from this. So if you can take on some meditation, do some exercise, that will help you out. The other thing that you need to look at, if it gets severe, is the possibility of prescriptions. Serotonin selective reuptake inhibitors are antidepressants that have shown good results with PMDD, especially fluoxetine, which is a generic Prozac. But other options are sertraline, paroxetine, citalopram, and escitalopram as well. Talk to your provider about the right choice for you. As far as your joint pain that you can experience, as long as you don't have any heart issues or bleeding issues, you could look at some non-steroidals such as naproxen or ibuprofen. That would help out. You may also talk to your doctor or provider about being put on a birth control And with that birth control, you want to look at one that contains both drospirenone and ethinyl estradiol, because it needs to be a combination birth control, not just a single pill. And that way, that will help you out to control some of those hormonal changes that are leading up to the PMDD. Some ladies as well may need to look at also a water pill or a diuretic to help with the fluid buildup that can occur with this. If you're starting to notice this every month as we're going through the second half of the cycle, I'm just not myself. It's more than just PMS. It's something added in there, and some of the physical things that I've described to you today as well. Talk to your provider. There is something that can be done to help you out.